And our next speaker is Jessica Kleindl. She's a family medicine nurse practitioner at Essentia Health in Graceville, Minnesota. Good morning, Jessica.
Good morning.
And I just wanted to note, I did look at her bio a little bit more in depth, and she had some fun stories about seeing different generations because of being a family practice provider. She can see the great-great-grandmother who's 102 and then the baby that comes in. So I think that that's really wonderful and a great way to practice medicine, really. So thank you, Jessica, for sharing your perspective on how primary care can support patients, and also maybe talk about prevention too.
Absolutely. So just a little bit about me. My name is Jessica. I'm a family practice provider in Graceville, Minnesota. I was actually born here, so I've been here for a very long time. They asked me to do, or if anyone wanted to, and I thought, well, I can probably manage this. So not only do I have a family practice, but my own family has a fair amount of all kinds of cancers in it. So as a family practice provider, I think it's really important to remember that don't be afraid to bring something up. Just because you've had a cancer diagnosis, there's all kinds of other things that can go on. There's other cancers that can happen, and we don't want you to forget about them. So with that, I'll start my screen sharing, and let me see if I can find my presentation. So the importance of primary care, if you think about yourself and your primary care doctor, provider in the middle, and if you would make a circle around yourself of a surgeon, cardiologist, your dermatologist, oncologist, those people are all kind of on the outside, and you and your primary care provider should be in the center of the circle. And the reason that in primary care we find that so important is because otherwise things tend to get lost, and we don't want anybody to get lost with just kind of floating out there, not sure whether they should go in, whether they shouldn't go in. So your primary care provider should be aware of all those things going on, because we really want to make sure that you're being taken care of as a whole person. All of your other medical questions about your family. And then the other part of any sort of disease, but specifically in cancer, your healthcare needs change as you age. We all know that cancer treatments can affect all kinds of other organs. Radiation is tough on the skin. It's tough on the organs that are around it. Chemotherapy, many types of chemotherapy will have effects on your heart, can have effects on your kidneys. So we in primary care want to make sure that not only are you getting those things looked after while you're in the middle of your cancer treatment, but they also have effects on that after as well. So we want to make sure that those things are being looked at. The other things that you can't forget about, mammograms, pap tests, PSAs, hypertension, asthma, high cholesterol. There's all kinds of other things that are going on in your body more than just your cancer. And I think that's important to remember, is that you're all more than your cancer. And we want you to remember about the rest of you too. So just a couple of kind of quick examples that I've had in my own practice. So the first patient, a 23-year-old female, 2 years post-treatment, no other health issues. We want to make sure that she's coming into primary care. She needs to still have her annual exam. We want to review with her her recent oncology appointments. We want to see what oncology has had to say, review those notes and find out, is there anything specifically they want us to be looking for? She's a 23-year-old female, so she should have her regular pap exam. We should talk about family planning, as especially in women, but in men as well. Family planning can become a concern depending on the types of cancer treatments that they've had. And so we want to make sure that that person isn't just floating around there on their own. If they need to see a fertility specialist, getting that set up, you know, especially as she maybe isn't interested in family planning at this point in time, but we also don't want to all of a sudden at 30 have her start dealing with this and never have talked about it with anybody. Routine lab work, and then also the discussion about possible long-term effects of her cancer treatment. And we never want anyone to feel like we're forgetting that they had cancer, but we also want to make sure that we're not missing something that we should. As I said earlier, cancer treatments can be tough on other organs of the body as well. The next case, and actually I can share this with you because it's not a patient of mine, it's actually my father-in-law. And so you'll look at his family history and you'll go, oh yeah, he needs to come in and be seen by primary care probably a little more often. So a 78-year-old female or male, 1 year post melanoma treatment. His personal family history, he's a farmer who's still working part-time. So I appreciate Brian's comments about, you know, being outside without sunscreen. And you can imagine a farmer outside all the time, probably without a hat, no sunscreen. And so his melanoma was on his ear, which is not a great place for it, but ears are kind of one of those areas that tend to be out in the open. So farmer still working part-time, severe history of severe osteoarthritis of both shoulders, history of atrial fibrillation, family history of a father with pancreatic cancer, a mother with breast cancer, daughter with multiple myeloma, granddaughter with Hodgkin's lymphoma, and son with glomerular nephritis and a basal cell carcinoma in multiple areas. So as you can see, it's very, very important. He needs to have regular appointments with his primary care. He needs referrals for orthopedics for his arthritis, cardiology for his atrial fibrillation, care coordination with cardiology, orthopedics, and then follow-ups for other cancers with PSAs, colonoscopies, and then his regular dermatology skin checks, along with his regular labs that he would need based on his medications that he's taking. So you can see in this case, especially, that there's all kinds of things going on with him. And if he is alone out there and trying to get to all of these appointments and there's nobody in the center to help kind of manage all of that, that's where we as primary care really want to be included. We want to make sure that all of these things are being addressed, and because they're all very, very important. So we like to think of primary care as the point person. The title is "When in Doubt, Give Primary Care a Shout." Just give us a holler. We can help you try and navigate some of that. Cancer treatments can lead to other health issues and other cancers. And so we want to be aware of that, and we want to not miss anything. Aging happens. That's kind of the goal. So we want to be sure that you're getting the right screenings for your age and gender, as well as your personal and family history, and not just your melanoma. And that is kind of the gist of it. Basically, just don't forget about us and come and make an annual appointment or a biannual appointment to get those screenings done. We like to see you when you're well. So if you're not well, we have a good idea of what's going on in your life.
Thanks so much, Jessica. really good reminders for everyone, and we appreciate all you do. Thank you.
Mhm.